Hey everybody, it's Alyssa here, and today I wanted to bring you part 2 of the 2-part series of my vet nursing pet peeves. Kind of a pet peeve along the same lines is especially like our shifts. We technically do a first shift and a second shift, and then we have a couple people that do third shifts. And whenever you work second shift, you're never getting out in time. Like, I'll be scheduled till midnight. You know the amount of times that I've gotten out at 2 a.m. and still have an hour drive home from work? It has happened way more times than I can count at this point, and it sucks because, like, yeah, I could leave at midnight, but there's one overnight person. There's 3 technicians leaving supposedly at midnight, but you don't want to screw them over. There's 15 patients on the board. You still have to clean. Like, I'm not going to sit there and be like, oh, like, you're on your own. Good luck. I'm going to try to do as much as I can, but then there's a point where I'm like, okay, 2 a.m. now I'm officially leaving. But still, like, it just sucks to never be able to get out on time. And, like, you're, like, looking forward to it. You're, like, the last hour. You're like, yes, we've got 1 hour left. We're going to push through. And then 3 more hours later. This is, like, a minor pet peeve. But I've never officially gotten bit from this, but when your coworkers are restraining for you when you're placing a catheter or trying to do a blood draw or trying to give like an IV injection or something, and they're holding, but like they're having a conversation with somebody else and they're not really paying attention, and you go to poke them and they're not restraining properly because they're not paying attention, and an animal like turns around and like tries to bite you. Pet peeve, smile, pet peeve. Just pay attention, please. Pay attention. I don't want to get bit today. I don't want to be on any more antibiotics than I have to be. Pay attention. Thank you. Another pet peeve. Bring your cat in a cat carrier. The amount of times people have tried to give me a cat, just like especially with COVID, because you have to be outside with them, and people are like, just here, take my cat. And I'm like, you don't have a carrier? Your cat could easily run away. Your cat's way faster than I could be. Like, dogs, okay, I could catch a dog. They're usually on leashes. Like, cats, no, they're not even trying. Like, they're gonna be gone. And then on the cherry on the cake is those cats that are in a carrier, but they're also fractious and trying to eat you. Please just put your cat in a cat carrier. It makes everybody's lives so much easier. Please don't bring them in a basket or in a cardboard box or in another box. Just use like a cat carrier, please. Please. Another pet peeve is when we get like people 11 p.m. on like a Friday night, peak busy time, because everyone comes in at like 5 or 6 and then like the wait. They come in at like 11 p.m. and their dog's been having a chronic ear infection that has not been evaluated by their regular vet for over 6 months. And then now tonight, nothing's changed. It's just an emergency now, which is fine. Okay, ear infection, annoying. Now you have time, now we can get it evaluated, cool, whatever. But then those people that have the audacity, after 2 hours, it's now 1 a.m., which staff, like I said earlier, gets reduced at midnight, and usually they're no longer taking cases, on top of all the critical things that come in. Now they're complaining about the wait, saying, how dare we make their dog wait? Their dog is very critical. We don't know what we're talking about. You waited 6 months to bring your animal in. Your animal's not critical if it has an ear infection. It's not. I'm sorry, no. You didn't have to come in at 11 p.m. on a Friday night at peak busy time. Sorry. Can't help you. Like, you're gonna wait or leave. Those are the options. So this is overall, doesn't matter what small animal practice it is, general practice, emergency, specialty, it doesn't matter. We all hate, with a passion, retractable leashes. Retractable leashes could be great. Hiking, outside, where it's like just you and your dog, whatever, cool. Easier for you, your dog can wander, whatever. In a veterinary setting, no, it is the worst thing on the planet. have a normal leash. Bring a normal leash to your vet. Don't bring a retractable leash. One, we really hate taking those, and I will do anything. People try to hand it to me, and I'm like, I'm gonna go get a slip lead. Please don't hand that to me. I don't want that. I, one, don't want to be irresponsible because I probably paid way too much money for that to begin with, let alone if your retractable leash for some reason doesn't lock. I'm not gonna have a dog fight happening on my hands because your leash didn't lock. And my personal biggest pet peeve doesn't always just happen at work, but it's like new people I meet when I tell them what I do, that I'm an ER veterinary nurse. Like, people, the first thing people always ask me, so you're an ER veterinary nurse, right? And I'm like, yeah. They're like, okay. They don't want to be like, so what do you want to do with your life? They're like, so you want to be a vet, right? No, I don't actually. Like, there's a very, very small percentage of veterinary nurses and veterinary technicians out there that actually are working as a veterinary technician or veterinary nurse and want to go to vet school and become a veterinarian. The general practice I worked at before, not a single person wanted to go to vet school. The ER I worked at before this one, not a single person wanted to go to vet school. Where I work now, there are a couple of the veterinary nurses that I do work with that are going to vet school, but that is also because we are 10 minutes away from a very large university that has animal science and pre-veterinary science as one of their majors that a lot of students take, and we're the closest ER and one of the closest animal hospitals around where they can get a lot of experience. So those few realistically are only at that practice. I have not seen other facilities where veterinary technicians or veterinary nurses want to go become veterinarians. And I do also compare it to people. When people ask me that, I say no, I do not want to be a veterinarian. And it's not an insult to veterinarians. I can make an entire video of why I don't want to go to vet school. Just too many factors that I'll make another video on. I don't want to be a vet. So when I tell people I'm a veterinary nurse, it's like kind of annoying at this point when people are like, so you want to be a vet? Like, they assume. It's not like, what do you want to do with your life, or where do you see yourself in 10 years? Like an open-ended question. It's like, so you want to be a vet? Every single time I say no. And then I compare it to how many human nurses are out there that have gone through their schooling, they are a nurse actively, and then they just want to do that entire 180. It's not really a 360 because it's still medicine. And they do that like 180, and now they want to do another 4-year degree and go to med school on top of residency and everything. I have not met a single human nurse that has done that. So it's kind of hard when people ask, because I make that comparison and then they're like, oh. I'm like, yeah. Just think about it a little bit. Like, veterinary technicians and veterinary nurses are the equivalent in veterinary medicine of a nurse, of a human nurse. Just like doctors, the equivalent of veterinarians. That kind of thing. But like, people don't think, veterinarians also have specialties. Veterinary technicians also have specialties. Nurses have specialties. Doctors have specialties. Like, veterinary technicians and nurses, I want to say more in a critical care kind of setting, do very similar roles to human nursing. I also know that because a lot of my friends are human nurses. So, and we talk about a lot of similar and contrasting things. So I wanted to thank you guys for watching part 2 of this 2-part series of my veterinary nursing pet peeves. Please like and subscribe, and leave any other video suggestions or comments in the comment section down below. And I'll see you guys in my next video. Bye everyone.